Hello.
Hello.
How are you? I'm Erin. I'm the nurse practitioner.
Oh, good. Nice to meet you. I'm Tom.
Nice to meet you too. What brings you in here today?
I'm here to just get my annual checkup.
Oh, okay. A physical?
Yes, please.
Okay. When was the last time that you had one?
Last year.
Okay. About the same time? Or?
About the same time. I'm a little late this year. I think it was January of last year.
Okay. And you wanted a physical for work or just to get checked out?
For work, please.
Okay. And is there anything that you'd like to discuss in particular with your physical?
No, nothing that I can think of.
Any just new health problems that are concerning you or any issues you want to address?
No, everything is actually going pretty good.
Okay. All right, great. So we are gonna start off by me just getting a basic history on you. I'm gonna ask a lot of questions, and then after that, we'll take you over to the office so that we can do the physical exam.
Okay.
Okay. Before we get started, is there any cultural preferences or religious beliefs that you want me to know about?
No.
No.
Everything's fine with me.
Okay. How do you identify yourself as your gender and your ethnicity?
Oh, I'm a white male, born male, married. I have a wife. I guess that's how it would go down.
Okay, and how old are you?
34.
34 years old. Okay. What is your occupation?
I am a sheriff's deputy.
Oh, okay. Where do you actually work?
I work at the courthouse.
Okay. What do you do over there?
Court security.
Okay. And so I know that we do actually a lot of the physicals for the sheriff's office. So they have a special form that I need to fill out, right?
Yes.
Okay, I can print that out and get this written all on that. Do you know if there's any other documentation that you need for the visit, labs, or any immunizations that are required for this year? Do you know?
No, not for this year.
Okay. Who was the doctor that you saw last year for your physical? Because this is the first time that you're in this office, right?
Yes.
Who did you see last year?
I believe it was Dr. Smith.
Okay, is Dr. Smith here in town?
He was actually, yeah, he was over at the urgent care center.
Okay. We might sign a release of information to get your records from there. How many years do you know that you went to him?
At least the last 3 years.
Okay. All right. Would you be okay with me having you sign a release of information to get your records from there?
Sure, that'd be fine.
Okay, thanks. So let's just start off with how would you describe your health?
I consider myself in generally good health.
Okay. Any concerns about your health or fears or?
I could probably afford to lose a few pounds, but overall, no, things are going well.
Okay. Um, as far as your health maintenance activities, would you say that you've been keeping up to date?
My maintenance activities?
Have you been like, do you ever check your blood pressure, check your weight?
Yeah, I check my weight. When I go to the gym and everything, I'll check it when I get there.
How about your blood pressure?
I don't know if like the Fitbit or like some of the machines you work out. I think that only just does heart rate, but no, I don't check my blood pressure.
Okay. Do you know if it's ever been high?
No, it's never been high.
Okay. Do you know if you have received your vaccinations?
Yeah, I mean, when I was a kid, I had pretty much all the vaccinations. My mom was very big into my health, so.
So you had all your childhood
Yeah,
immunizations?
definitely all the childhood.
Do you know if you got any of the adult boosters?
Yes, when I was a teenager.
Okay, and
Mm.
like your hepatitis B, do
Hmm.
you know? I know that the sheriff's office
Yes.
usually you have to get those shots before you can work there.
I did get that series with them.
Okay, and we can check your records and see if if there's anything else that you're due for. Did you get a flu shot this year?
No, I did not get a flu shot
Okay,
this
are
year.
you interested in getting one?
No, I'm okay.
Okay,
Yeah, I don't need one.
okay. Did you get do you know if you got a pneumonia vaccine?
Pneumonia vaccine. I don't believe so, no.
Okay, all right. We can just check your records. Do you know if you had a TB test?
Yeah, I had a TB test last year for my physical.
Oh, okay. Have you ever had any stool test for occult blood?
No.
No. Any colonoscopy?
No.
Okay. Do you know when the last time that you had labs drawn was? Like a baseline set of labs?
That would probably be last year's set of
Do you think you
physical.
got them when you did your physical last
Yeah.
year? Okay. All right, great. As far as health habits go, can you just tell me a little bit about how, exercise, diet, stuff like
Um,
that?
I think I try to get to the gym about twice a week. Um, I do go for long walks with my wife and my dog, after work and everything. So
Okay, like
do
every
have that.
day or
Yeah, every day
okay,
do that.
that's good.
And I usually stay fairly busy at work.
Okay, you have an active job.
Yeah, I'm always usually walking around or moving.
You said you have a Fitbit. How many steps a day do you usually get?
Anywhere between 8 and 12,000.
Okay, so that's pretty good. And then as far as your diet goes, um, do you eat breakfast in the morning?
Yes. Usually something light. Like a shake or an oatmeal or something like that, some fruit.
And then how many meals a day would you say you get?
About 3 meals a day. A few snacks in between.
Okay. So some smaller meals and then
Yeah.
3 regular meals. Okay, and do you eat fruits, vegetables?
Yes.
Okay. Do you eat meat?
Yes.
Okay. Would you say that you have a balanced diet or do you eat a lot of junk food or
I don't eat a whole lot of junk food. I think it would be considered a balanced diet.
okay. I mean, the food pyramid, you get like a little bit of everything, would you
Yeah.
say? Okay. Um, do you have any restrictions on your diet?
Nah.
No, any supplements that you take?
I take glucosamine for joint health, and I do take a multivitamin.
Okay. And do you smoke cigarettes?
No.
None. Okay. Have you ever been a smoker?
Yes.
When did you start smoking?
I started smoking when I was, let's say, 17, 18.
Okay. And how many? Do you know when you quit?
I quit at 22.
22. Okay, so you smoked for about 5 years.
Hmm.
Okay. And how much did you smoke when you smoked?
I was smoking a pack and a half a day.
Okay. And then you just quit?
Yeah, I actually got pneumonia, and I was pretty much sick for the entire time, so I quit cold turkey.
Okay, well that's great. It's like the best thing you can do for your health. So, congrats on that. Um, how much do you drink alcohol?
I think about 2 or 3 drinks a week.
Okay. Is it usually at one time or one?
It'll usually be at one time, like usually leading up towards the weekend.
Okay.
Like,
You'll go out and have a few drinks.
yeah.
Okay. Do you drink during the week at all?
I try not to.
Okay. And would you ever say you had a problem with drinking?
No, I wouldn't say I had a problem.
Okay. Do you ever drink more than 3 drinks?
Yes.
How many would be the most?
Um, Probably the most would be 7 to 10.
Okay. And how often would you say that happens?
Oh, that maybe once or twice a year.
Like New Year's Eve or something? A wedding?
Yes.
Okay.
Generally, it would be a party.
Okay. You try not to do it too much?
No.
Okay. And then any street drugs?
No.
No. Any marijuana?
No.
Do you take any prescription pills?
Nope.
Any opiates or benzos, anything like that? Okay.
Nope.
How much caffeine do you drink every day?
Oh. Let's see. I would go with about 4 cups of coffee.
Okay.
Because we do the little shots of Bucci, and I believe those count as a cup of coffee.
The like little espresso shots.
Yeah, little espresso shots.
And you drink those in the morning or the afternoon? Or all day?
Usually 2 in the morning and 2 right around after lunch, like around 2 o'clock, 3 o'clock.
Okay. Any other caffeinated drinks like sodas or energy drinks?
I'm off energy drinks. I'll have a soda every once in a while.
Okay.
I do enjoy tea sometimes.
Does the caffeine keep you up at night at all?
No, not really.
Okay. Okay. What would you say for your sleep? Like, how many hours a night would you say that you get?
I'd say 6 to 7 hours of sleep.
Okay. Do you usually get that every night?
Yeah.
Yeah. Do you ever get less?
Sometimes.
Yep.
Depending on what's going on.
You try to aim for 6 or 7?
Yeah.
And then, do you ever sleep like a lot, like a lot more, or?
Sleeping in on the weekends count?
Yeah.
Yeah. I try to catch up a little bit on Saturdays.
Okay. All right. So now we just want to talk a little bit about, stressors. What would you say that your stressors are?
Just work, school, my dog.
Why does your dog?
My family.
Why does your dog stress you out?
Because my dog eats the house.
Is it a puppy?
Yeah, she was a puppy, but now she's becoming more of a rough and tumble teenager.
Oh, okay. And you're in school. You're getting another degree. Or?
I'm working on my bachelor's. I'm taking computer classes right now to fill out an elective portion.
Oh, okay. Over at the college,
Yep.
Okay.
Over at the community college.
And that's stressful for you?
Yeah, it's school, especially when you're working a full-time job.
Mm-hmm.
Here it takes a day away from my family and everything. So.
How do you cope with stress?
I do try to work out. I talk to my wife. We go on long walks and try to air out everything that's been going on with us.
Okay.
Good communication.
Okay, those would be your coping strategies?
Yeah.
Okay, great. Do you have any allergies to anything?
No.
No medication? No allergies to any medication at all?
No.
No seasonal allergies like stuffy nose?
No.
And you've never had an allergic reaction to any kind of food?
No.
Okay, great. When you were a child, were you healthy? Did you have any childhood illnesses?
Let's see. I had the chicken pox when I was a child.
Okay.
I suffered migraines when I was a child.
When you were how old?
As long as I could, as far back as I could remember, I think roughly from 4 or 5 on to about my teenage years.
Okay, and then they went away?
Yeah, they started to go away after I had my growth spurt.
Okay. You don't have migraines now?
No, not anything like that. I think it's just regular headaches at this point.
Okay. Do you have any chronic conditions now, like asthma, diabetes, high blood pressure, thyroid problems, any musculoskeletal problems, anything like that?
No, I don't have any of those problems.
Okay. Nothing that you take medication for on a daily basis?
No.
You haven't been diagnosed with any kind of disease at all?
No.
Okay. Have you ever been hospitalized?
No. I mean, do you mean gone to the hospital for something, or?
Sure.
Oh, yeah. Here, when I fell down and I had a couple of ribs cracked about, gosh, 7 years ago. I went to the ER. Can't do too much for cracked ribs other than just wrap it up and take it easy. So
Yeah.
that was it. And then
What happened?
oh, I slipped on a flight of stairs.
Okay. And do you know how many ribs you brought? You broke. I'm sorry.
2.
Two. Okay. Any other broken bones in the past?
Broke a long bone on the side of my foot, on my right foot when I was about probably 9 or 10.
Okay. Anything else?
No, nothing else that I can recall.
Okay. Have you ever been in the hospital overnight for any reason?
Nah.
No. Have you ever had any surgery? Any
Nope.
minor surgery at all?
My,
Major dental work or?
I mean, I had braces when I was a kid. I did have some cosmetic work done. I did have like a cyst growing in between the bridge here, and the doc removed it.
Okay. Any do you ever have anything like your appendix removed, your tonsils
Oh, no.
removed, your gallbladder,
No,
appendix?
no, nothing invasive. No.
Okay. All right, good. So yeah, it sounds like you are pretty healthy. Besides the accident with your foot and your ribs, have you ever had any other major accidents, like car accidents or head injuries?
I have been involved in car accidents, but I was never injured in any of them.
Okay, so no loss of consciousness.
No,
You've never been in a
no,
coma. No major trauma, like
no,
any blunt objects, stabbed or anything like
no,
that.
no, no,
I
no.
know. I mean, working for the sheriff's office, sometimes people get into fights or get, have your head banged or.
Actually, in training, yeah, I mean, I did ground fighting training and everything where we were going through different things. So yeah, I mean, I got kneed in the head one time. I got woozy from it. I didn't lose any consciousness or anything like that. And no, that would be it.
No contact sports when you were growing up or anything like that?
Let's see. I did track, cross country. No football really. I wasn't any good at it. Nah.
Okay. All right, great. Um, so, do you take any medications at all?
No. No medications.
So just besides the multivitamin, the glucosamine.
I mean, here if I, get a headache or a muscle ache or something, I'll take aspirin. Maybe, once or twice a week.
Okay.
But that's only if, something hurts.
And you take just one aspirin?
I try to take as little as possible, so if I can get by with one, I will. I'll take 2 if I need it.
Okay. Those are just like the regular 325 milligram aspirin? Okay. Do you take any kind of herbal medications? Any other supplements?
No.
Okay. Any other over-the-counter things besides the aspirin?
Over-the-counter things. Oh, I was wondering. I do drink this since it gets into like cold and flu season to just keep it up. Emergencies.
Mm-hmm.
It's like, I don't know if that's like
It's a vitamin C drink, yeah?
Yeah.
Okay. Anything else for colds or?
Nah.
Do you ever borrow any of your like medication from your family or friends? Take anything for any other kinds of conditions like the
No.
headaches, or okay. Have you ever had a seizure?
No.
Okay. Um, just want to go over your family history a little bit. So we'll just start with like your parents, your mom, your dad. Are they alive?
My dad passed away. My mom's alive.
Okay. And how old was your dad when he passed away?
My dad was 45.
And what happened?
He had a heart attack.
A heart attack. Okay. Do you know if he had like heart disease or high blood pressure?
I'm not 100% sure. I know that it was his second heart attack finally that finally killed him.
He had one before that. And then
A minor one.
how old were you when he passed away?
I was 10.
Okay, so it happened when you were a young man. Okay. All right. Do you know if he had any other conditions like diabetes or any thyroid disorder, asthma, cancer,
No.
anything like that? So just the heart disease. Did he have any drug or alcohol problems?
He did use substances. I know he liked to party. I know he used cocaine and marijuana and drank.
Okay. Do you know if heart attacks, like did anyone else in your family have a heart attack?
On my dad's side of the family, it would be my grandfather. He passed away of a heart attack as well, I believe at 49.
Okay. And did he have problems with drinking too, do you know?
Yes, he definitely had drinking problems.
So he had a heart attack as well. And how about your dad's mom? Do you know if she had any health problems?
No. As far as I can tell, she was okay.
Okay. And then your grandparents, or I'm sorry, your mother, does she have any health problems?
Let's see. She did have a benign tumor taken care of about 12 years ago, using the gamma knife.
Okay. So it wasn't cancerous?
No, it was not.
Okay. Do you know if she
But
has
it
any
was in her
chronic?
head.
I'm sorry?
But it was in her head, so.
Oh, wow. Okay. Do you know if she has anything like asthma, diabetes, high blood pressure, seizures, coronary artery disease, thyroid problems?
Was it OCT or she did smoke for a lot of years.
COPD?
Yes, that's it.
Okay.
She does have that. She's had both of her knees completely replaced.
Okay. And was your dad a smoker as well?
No.
And then how about your grandmother on your mom's side?
My grandma on my mom's side. Let's see. She had hip surgery.
Okay. Any other chronic health conditions?
For her? No.
Okay, and your grandfather on your mom's side?
He passed away of a heart attack.
He also had a heart attack. Okay, do you know if he had heart disease or?
No, I don't know if he had heart disease or not. He passed away at 67, I believe.
Okay, and did he have diabetes or cancer? Any of them have strokes?
Nope.
Not that you know of? Okay.
No.
Okay, any psych problems or alcohol and drug problems on your mom's side?
On my mom's side?
Mm-hmm.
Let's see. No, nothing I can think of.
Okay. Do you have any siblings?
Yes, I have one sister.
Okay. Does she have any health problems?
No, she's in okay shape.
Any psych problems or drug problems?
No.
Any alcohol abuse?
No.
Okay. Any other siblings?
No.
Do you, do you have any children?
No, one on the way.
Oh, congrats.
Thank you.
All right. Any history of suicide? Anyone in your family?
No.
Any other significant health problems of anyone that we didn't mention? Aunts or uncles or great grandparents, anything like that?
No, nothing about great grandparents. No. Generally everybody's in good shape.
Okay. All right. That is the genogram of Tom's family. Okay. Let's see. How about any psych issues with you? Have you ever been hospitalized for any psych problems?
No.
No. Any depression, anxiety, problems with your mood?
No. I wouldn't say so. I think I've been pretty much generally mentally okay.
Okay. All right, great. Any suicide attempts in the past?
No.
No. Any thoughts of wanting to hurt yourself
No.
or wanting to hurt other people?
Sometimes, but those are very fleeting thoughts.
Okay. Can you talk more about that?
I worked in the corrections environment from time to time, so sometimes things would get, very stressful and guys would fight back, and I would have to do what I need to do to control the situation, or sometimes things would happen and I'd be very angry, but then I would just be very professional about it.
Mm. Do you ever have any trouble with like disciplinary action for anything like that?
No.
No. Do you ever find that it affects your ability to function?
No, it doesn't affect my ability to function.
Do you have a way, like a release for that kind of stress?
Yeah, sometimes after the situation's dealt with, you just step back, take a breath, compose yourself, and, just let the anger subside.
Okay.
Get a clear head.
Anything else that you do to relieve stress? You ever try any do you ever talk to a counselor or do yoga or I know you said exercise.
Yeah, I mean, here I've tried yoga and the meditation and everything. I mean, necessarily doesn't do all that much for me. I find working out does a lot better for me.
Okay, so going to the gym or
yeah, more physical activity seems to do better for me.
like cardio or
yeah.
Okay, all right, great. I know you mentioned your wife is a good support system, and you're expecting a child. So do you have another any other support?
Yes. Me and my wife, we have good friends. She has a lot of family where we're close by. My family isn't so close. But yeah, I think we have a lot of support.
They're not you're not close with your family at all?
No, they live 2,000 miles away,
So they're not close in proximity wise.
Right.
Okay. Do you have friends that can help?
Yeah.
Okay. And how about, I mean, your family of origin? I know your dad passed away, but your mom and your sister, are you in touch with them?
Yeah, I talk to them maybe once or twice a week.
Okay, great. Your living situation, who are you currently living with?
I live with my wife and my dog.
Okay, and where do you live?
I live in town we have a townhouse together and everything. It's a 2.5.
Okay. And how is your house in terms of safety? Do you have a fire alarm?
Yes. Yeah, we have a fire alarm and all that.
Okay. And then do you keep weapons in the house?
I do. I keep weapons because I have work, but I have a lockbox. I put them in.
Okay, great. How about when you drive in the car, do you wear a seatbelt?
Yes.
Okay. Do you ride a bike?
No.
Okay. How about when you go out in the sun? Have you been wearing sunscreen?
Yes.
Okay. Yeah, actually, your skin looks like you probably wear sunscreen. Yeah, you don't get sunburned or anything.
I
Living in South Florida,
I
a lot of people
yeah.
don't have as nice skin.
I just sunburn very badly, so I try to avoid it when I can.
Okay, that's good. Um, how about you told me about your job and your school. Have you ever been in the military at all?
No.
Okay. Um, how are your finances?
Finances are okay.
Okay. Any issues?
No, I think just what average people go through, paying the mortgage and the bills every month.
Okay. Any major debt or things that cause you stress?
No, no, nothing really.
Okay. You and your wife both work?
Yes.
Okay. And then how about your sexual activity? How would you describe that?
I would consider it's good. It's okay. Wish there was more time, but me and my wife have very busy schedules to keep.
Okay.
So unfortunately, it takes a little bit away from the romance aspect.
Okay. Any concerns in that area?
Nah.
Any problems with function?
No.
And then since you've been married, have you had any other sexual partners?
No.
Okay. And then before you were married, did you have any, would you consider high risk partners?
No.
Have you been tested for STDs?
Yes.
Been tested for HIV?
Yes.
Okay. Any concerns that you might have anything like that?
Nope. Everything came back negative.
Okay. All right. Great. And then what do you do for fun, for your hobbies, your personal interests?
Oh, let's see here. I like to read. I play video games. Uh, golf. Not as much as I'd like to, but yeah, I like to go running, swimming. Generally, just try to spend time with my family when I can. I like cooking.
Okay. Good. Awesome. So now I'm just going to ask you a lot more questions, kind of quickly,
Okay.
and you can just sort of say yes or no, and then if there's an issue, we'll go into it a little bit further. It's going to seem like a lot of questions all at once, but I just want to make sure we don't miss anything. Okay.
Okay.
How's your vision?
Good.
How is your dental health?
Good.
Any problems? Any pain with
No.
your teeth? Anything that's bothering you?
No.
Okay. How is your hearing?
Good.
How are your other senses?
They're all good.
Any problem with taste, smell,
No.
like sensation, tingling in your extremities, touch?
No.
Okay. Have you had any trouble breathing? Any cough? Any wheezing?
No.
Any issues at all with your lungs?
No.
Any problems with your heart that you know of?
No.
Any chest pain?
No.
Palpitations? Racing heart?
No.
Okay. Have you recently had any weight loss or weight gain?
Actually, I've gone through some weight loss. It's only been about 6 pounds.
Were you trying to lose weight?
Yes.
Before that, had you had some weight gain?
Yeah. I'm hovering around the 200 area. I'd prefer to be down to about 180 or so.
Okay. Okay, that's good. How has your appetite been?
Good.
Any problems with digestion or heartburn?
No.
Okay. Any problems with going to the bathroom?
No.
No. Any problems when you urinate, like going too much or stopping during the middle, or
No.
any problems with the flow when you
No.
go pee? No. When was your last bowel movement?
This morning.
Okay. How often do you go have a bowel movement?
Once a day.
Okay. Would you say you're pretty regular?
Yeah.
Any changes at all with your stool?
No.
Okay. Any problems with your muscles or joints? Any pain? Any, problems walking? Anything causing you stiffness or soreness?
No.
Okay. Do you have any open cuts or sores on your skin?
Nope.
Okay. Do you have any issues with pain at all anywhere in your body?
No.
Any cramps in your legs, swelling in your feet?
No.
Okay. Do you ever get up to go pee in the middle of the night?
Yeah.
Do you do that every night?
No.
Ever more than once in a night?
No. Just the once if it happens.
Okay. Do you have any hernia? Any hernias?
Nah.
Okay. Any hemorrhoids at all?
No.
Any blood in your stool ever?
No.
Okay. Do you have any discharge or sores in your penis?
No.
Any pain in your testicles or masses or lumps?
No.
Do you check your testicles? Do you ever feel and see if there's any masses or lumps in them?
Every once in a while. I mean, probably if I'm in the shower, that
Okay.
would be when I do it.
Okay. Any scrotal pain or swelling?
No.
Okay. And you said no problems with your mind, no problems with your mind playing tricks on you, or
No.
if you ever hear things that other people don't hear, see things other people don't see?
No.
Okay. Any nightmares?
No.
Night sweats?
No.
No. Any recent mood changes?
No.
Okay. Are you doing okay in school?
Yes.
Okay. Any dizziness or fainting or vertigo, weakness?
No.
Okay. You said you've never had a seizure, right?
No.
Have you ever had a blood transfusion?
Nope.
Any problems with bruising or bleeding?
No.
Any problems with your thyroid?
No.
Do you have any problems with excessive sweating?
I sweat a lot sometimes.
Would you say more than normal?
I would say probably more than normal people.
Okay. Any changes recently?
No. I mean, it's just. I think it's just something that happens. I also lived in South Florida, so it just tends to be hotter down here.
Okay.
So.
All right. We can check your labs too and just make sure that everything seems okay.
Okay.
Any problem with like heat intolerance, cold intolerance?
Like, no, I don't think so.
Okay. Any excessive hunger or thirst?
No.
Okay. Have you noticed any change in the size of your feet or your hands?
No.
Okay. Okay. Well, I think we'll just move on to the physical exam.
Okay.
Thank you.
All right. Thank you.